In this training programme, we will be looking at how to assess general damages. During the programme, we will consider how to review the medical report, how to identify the key injuries, and also the tools you will use to value the injuries. We will be looking specifically at the JSB guidelines and also case law. We will also work through a case study to assess the key negotiation points and to provide you with some tips on how to manage your client's expectations. The objectives of this training programme are to provide you with the skills to be able to accurately assess the medical evidence in a typical fast-track case. By the end of the session, you will be able to use the quantifying tools available to accurately value the injuries sustained by your client. First of all, we are going to consider what general damages are. General damages are compensation for the personal injury element of the claim. There are other damages which fall into the category of general damages, but we are not going to consider these at this stage. When you are considering how much your client's injuries are worth, you will be considering the level of pain, suffering and loss of amenities suffered by your client. This is often referred to as PSLA. The value of the claim will depend upon the effect the PSLA has had on the claimant's life since the accident. If the claimant has suffered a whiplash injury to his neck, but has had no time off work, and was able to play football a week after the accident, then the level of suffering is obviously minimal. However, if your client has had to take 2 weeks off work and has not been able to attend the gym for 6 months, this means the level of PSLA suffered by your client is far greater. This is what the courts and defendants will be considering when they are valuing your client's claim. You need to be able to accurately assess the level of PSLA suffered by your client from the outset. The medical expert will provide a prognosis period in his report, but if your client is still suffering once this date has been reached, then you will need to consider what further medical evidence is needed to assist you with accurately valuing the claim. When you receive the medical report, there are a number of key points which you will need to identify. It is not enough to simply identify the injuries and recovery period. You also need to assess other factors which will affect the value of the claim. When we look at case law later in the programme, you will see that in order to carefully match your client's injuries with a similar case, there are a number of different ways to do this. The first point to identify is of course the injuries sustained. In a straightforward RTA claim, the types of injuries you are likely to see are neck and back whiplash, cuts and bruises, scarring, leg or knee injuries, shoulder injuries, head injuries, and psychological trauma, such as travel anxiety, phobias, and in more serious cases, post-traumatic stress disorder. Once you have identified the main injuries, you then need to establish whether the claimant attended hospital, and if so, what treatment or prognosis were they provided with. Did the claimant subsequently receive any further medical treatment, and did they attend their GP? You then need to consider the reported effect the accident has had on the claimant's life, his time off work, and effect on recreational activities. The expert should then provide a prognosis for a recovery period. If this cannot be provided at this time, they should suggest a further examination or referral to an expert in a specialist field.